Good morning, Dumelang, Sanibonani, Sawubona. Good afternoon, everyone. Welcome back to the Virtual Symposium of Harnessing Data Science for Health Discovery and Innovation in Africa. This workshop is facilitated by the National Institutes of Health Common Fund. My name is Mahadia, and I'm here with my colleagues from Know Innovation, the facilitation team that is supporting this virtual event. We are your hosts for the Virtual Symposium this week and next week. And our brief agenda is right behind me, but just to take you through it, we will have some welcome remarks and training the next generation of scientists overview by our program officer. Then after that, we'll have the panelists highlights. The panelists will be here to give their highlights and answer a number of questions. Then we'll have some time to connect on our own through breakaway sessions and have some discussions with each other. And then we'll come back for a plenary conclusion. So at this moment, I would like to hand over to Laura Pavlish, our program officer at the National Institutes of Health at the Fogadin International Center. Over to you, Laura.
Thank you, Pulang, and welcome everyone to our panel on training the next generation of data science and health innovation leaders. A major part of the Fogarty International Center, where I work, is to build health research capacity in low and middle income countries. Recently in Africa, we've managed to set up 4 bioinformatics research training awards that are working to establish and run bioinformatics curriculum in 6 institutions across Africa. We're really excited to have the opportunity to launch DSI Africa and continue this new wave of health data science and computational capacity building by supporting the training and development of new research leaders and other forms of capacity building throughout the entire DSI Africa consortium. Our accomplished panel today has showcased some of the foundational health data science training happening in every region in Africa in their pre-recorded videos that streamed right before this live session. I'm sure that everyone has and will continue to learn from their vast experience in data science and innovation training. During the panel this morning or afternoon, please target your questions at the panelists and their experience or opinions. Any questions regarding the funding opportunities can be posted on KaiStorm, emailed, or asked during office hours at the end of the week. So thank you for joining us today. I'll hand it back over to Know Innovation to go over some important technical details for our panel. Thanks.
Thank you very much, Laura. My name is Maggie. I'm also with Know Innovation, and as Pulang mentioned, we are the hosts for this event. You'll hear us referred to as KI, and that's the KI in KaiStorm. We're a team that specializes in accelerating scientific innovation, and we facilitate events that we hope inspire researchers from different disciplines to come up with exciting and novel research. And lately, because of COVID-19, we found ourselves hosting meetings like this one. We've learned it takes a lot of people, so I just want to acknowledge my team. With Pulang, I'm here with Joe and Emma and Binyam. So for you, a few key details to make the most out of this session today. You will only be able to participate in the breakout discussion that's coming up later if you've joined with the Zoom app. So make sure you've used the app and you're not just in through your browser. Okay? If you have any tech questions or you get lost, please know that you can always scroll down on the KaiStorm left-hand menu to the Need Help page, and we'll help you sort it out. You can also come back to plenary if you happen to be in a breakout session and you get bumped out. We'll make sure you get where you need to go. Up until now, we've invited you to leave questions for the panelists on KaiStorm while previewing their videos or at the screening. I think there are a couple of questions there now. And if you have more questions today, you may, of course, add them there. Or if you prefer, you'll be able to add them in the chat here in this Zoom. For now, however, we have the chat off, just in order to not distract from listening to the open remarks of the panelists while they're doing that. But as soon as we get into the questions and answers, we'll be opening up the chat, and you can participate that way as well. We are recording the session today, so if you want to review the video later, you'll be able to find it on KaiStorm and also on the NIH YouTube channel. Pulang.
Fantastic. Thank you for that, Maggie. And If you are active on social media, we would like to invite you to use the hashtags that Maggie is displaying on the screen. So the first one is the hashtag DSI Africa, hashtag NIH Africa Data, and also hashtag No Innovation. So those are the 3 hashtags that we are using for the entire event today, tomorrow, and Wednesday. Now, we are really curious about you and also what your interests are from today's panel. So we would like to pop in a link on the chat. If you go to the chat, you'll see a link to a poll, and would like to ask you, why are you here? What are you seeking in this meeting today? Are you looking for collaborators for a training application, or are you looking to learn new approaches to train health data science and researchers, or are you just here to find opportunities for health data science training that you might take, or to network with others who are interested in capacity building in health data science? We're really curious, and this is going to help us to make sure that your objectives, which may be of interest to you and to us, can be covered today. So please have a look at the chat, click, fill in the poll, and let us know why you're here and what you're looking for. And as you do so, we are displaying on the screen the results that we're getting. Interesting that majority of you are saying you're here to network with others who are also interested in capacity building in health data science. That's amazing. And then you're also interested to learn about approaches to train health data scientists and researchers. That is fantastic. And if we could have a few more of you fill the survey if you haven't yet. We'll give you a couple of seconds. And this gives us a good indication. So networking, learning about approaches to train health data scientists and researchers. Fantastic. Thank you so much. I'll hand back to you, Maggie.
Sure, okay. It's time to get to the panel already, and let's start with our moderator. So our panel moderator today is Dr. Martin Were. He's an associate professor of biomedical informatics and medicine at Vanderbilt University. His current area of research and service is in global health informatics. Previously, Dr. Were served as the Chief Medical Information Officer at the AMPATH program in Western Kenya. It's one of the largest HIV care programs in sub-Saharan Africa. As part of his interest in capacity building, Dr. Were has played a critical role in establishing the Institute of Biomedical Informatics at Moi University in Kenya, and he currently serves as its acting director. He is also the project lead for the Health Informatics Training and Research Program in East Africa for improved healthcare, known as HITRAIN. Through his work, Dr. Were led the development of master's and PhD level health informatics curricula at 2 universities in Kenya and Uganda, and he is actively engaged in teaching several courses in health informatics. Obviously, this is a topic that he has passion about. I hand it to you now, Dr. Were.
So thank you, Maggie and the No Innovation team for the introductions, Laura and the NIH for helping us get this panel organized and going. So thank you very much. I wanted to take this opportunity to welcome everyone once again to the panel discussion on training the next generation of leaders in data science and health innovation in Africa. It is my hope that most of you have had a chance to look at the presentations by our panelists. And if you've not, I'd urge you to take a moment afterwards to review them. We have an excellent group of panelists, and I'm very excited to spend the next 2 hours with them. The goal of this panel was to actually engage panelists who have real-world and diverse experience in capacity building around data science in Africa. So we did not want to just have a theoretical discussion, but we wanted a discussion that's grounded with real-world experience in capacity building around data science. What do we hope to achieve in the next 2 hours? Okay. First and foremost, We hope to learn and gain insights, obviously, around capacity building from our panelists. But more importantly, we hope to have a vibrant discussion around the various capacity building approaches in data science, especially those that are relevant to the African setting. So the discussions will touch on a range of issues, and I'll name some of them, okay? We hope to help identify and find approaches around how you analyze the capacity gaps in data science before you are kind of training intervention. We will discuss which capacity building modalities in data science are most relevant to the African context. Hopefully our panelists will share with us some of the networks and resources that exist in capacity building on data science within the African continent and in other places. We'll discuss approaches to multidisciplinary training, given that data sciences are a multidisciplinary field. As part of the breakout and thereafter, we'll also talk about some of the challenges experienced through capacity building projects. And also we'll discuss issues of competency, quality assurance, accreditation, among those things. And also we hope to get a sense of the gender equity issues and how to address them as it comes to data science capacity building. We encourage you to participate actively in the discussion. As you've been told, you can ask questions through the various channels. And also we want you to engage very deeply in the breakout session. Obviously, networking is a key part of this session. And so we hope that by the end of this, you'll have met a few individuals with whom you can continue interacting with and working together on capacity building in data sciences for Africa. So to start us off and to set the stage for the discussions, I'm going to ask each of our panelists to use 2 minutes to both introduce themselves and to provide highlights of their talks. So we'll do it in this order. We'll start with Mahadia Tunga and then Mel Quila, followed by Jeremy Zuri and Ignace Kabano. So Mahadia, the stage is yours. Please take it on.
Great. So good morning, good afternoon, and good evening from wherever you are. I'm so much delighted to share my experience. My name is Mahadia Tunga. I'm a co-founder and director capacity development at Tanzania dLab in East Africa. It's an organization that mainly focuses with the main mission of ensuring data is frequently and effectively used at different levels. Sharing a bit of my background for capacity building programs is that when we are delivering these capacity building programs, it's important to think of short-term and long-term programs. Short-term program in a sense that building tailor-made programs for organization or individuals, and most importantly is to first analyze what are the target, what is the key challenges, and how are we, are we using data science skills to solve such challenges? But also it's important to develop long-term strategy in order to develop an expert in the area. And with that, for instance, at Tanzania dLab, we have partnered with the University of Dar es Salaam and developed an MSc in data science program so that we can develop, we can produce data science expertise and we are supporting them with, for capstone projects and also for the practicums. But also the other last thing that I wanted to share is that data science and other emerging technology, the challenge is to involve more women. So we should ensure that with our capacity building programs, we are not creating a digital divide or a gender disparity. Therefore, it's important also to think on how to think on the inclusion aspect. And the most important thing is to try to catch them early as we are training these college students and future leaders, but also try to think at the lowest level, high level, on how we can tap such minds. Yeah, thank you.
Yeah, thank you so much, Mahadia. I really appreciate that brief highlight. Next, we have Mel Quila. Please take it on.
Martin. Hello, everyone. Happy to be part of this panel. So I'm Mel Quila. I'm a bioinformatician with a computer sciences background. I currently work for Exceptive as a scientific program coordinator, where I support the coordination of a data science for public health program. It is a program of the Bill and Melinda Gates Foundation in Africa, India, and Brazil. And the aim of this program is to build the data science community and have this community collaborate with physicians and biologists and leverage existing data. I previously worked for H-Ray Bionet and spent the last 6 years basically working on capacity building programs. And I'm really glad to see many of my former colleagues here in the room, and I really encourage you to sort of get to know them during the breakouts. So as part of H-Ray Bionet, I led and contributed to design many of the capacity building activities. And a lot of them included training trainers in different regions in the continent who were able later to sort of keep the ball rolling and train other people in their regions. We focused our capacity building on a sort of mixture between in-person and online programs. We ran, for example, an introduction to bioinformatics course that has been followed by more than 3,000 people during the last 3 or 4 years. We also spent a lot of time thinking about how to get people to collaborate and get people together in the same place to tackle a scientific problem or work on a specific data set. So we ran a lot of hackathons where we basically bring people together to develop bioinformatics workflows, or we also worked on preparing some data sets for crowdsourcing global challenges. We, for example, contributed in starting a challenge around malaria drug resistance. We also ran a lot of open science activities, and the idea is to raise awareness about the importance of reproducible science, especially in this field, and how that can contribute to advancing science. Yeah, I think I'll stop here. Thank you.
Yeah, Amel, that's excellent. I think you've touched on so many modalities that you've used, and the experience is just wonderful to share. Jeremy, I'm going to hand it over to you.
Hello, everyone. I'm glad to be part of this initiative. I'm Jeremy Zwe, the African Spectral Imaging Network Coordinator. I'm here to share with you our experience in training leaders in data science and innovation in health. Over the past decades, I've seen has been committed to training talented young scientists from across the continent in both applied light technologies and data science as a means to address health problems. As experimental physicists, constructing various scientific instruments to tackle developing issues, we have found data science to be a very useful and effective alternative approach to analytic methods. Therefore, data science is playing a key role in upstream training strategies as an essential research field to support the development of scientific and technical equipment that is based on light technologies. These strategies has paid off and is now enables our former students to have brighter future as they build their scientific career. The effective implementation of the training program requires us to identify appropriately the right technical and scientific problems to be solved. This is illustrated through both the following examples. Among other things, we have developed, firstly, an entomological LiDAR to address vector control, and secondly, a spectral microscope that is both fast and accurate in detecting malaria. In both cases, In addition to developing innovative scientific and technical instruments, we note that the two systems stand on data science methods. The entomological LiDAR aggregates several terabytes of data. The size of the data requires, firstly, the identification, discrimination, and classification of thousands of insects, and then the detection of female mosquitoes from the whole Antona fauna before correlating the abundance and variabilities in space and time. The same data are combined to the meteorological parameters and help scientists create models for mosquitoes forecasting. Together, this requires factor analysis, classification algorithm, and machine learning in line with data science methods. In the case of the spectral imaging microscope, because of the chemical staining is replaced by a spectral fingerprint, the differentiation between the infected and healthy blood cells requires machine learning, classification, and factor analysis models and algorithm if we want to determine accurately whether or not the patient is sick. As can be seen, scientific and technical skills alone are not sufficient in these cases to solve problems. Data science represents a substantial part of the instrument development process. Building effective instruments to address health problems combines both scientific and technical skills involving investigation methods like the ones provided by the data science approaches cited above. I invite your input in order to deepen and enrich the discussion on the various issues raised by these opening remarks. Thank you very much for your attention.
Thank you, Jeremy. Every time I hear you speak, I feel like I need to go back to school because there's so much in there. But you also highlight the multidisciplinary nature of data sciences and data sciences training. And so we hope you're going to be able to talk to us more about that when you get to the question session. Ignace, 2 minutes, just brief introductions and highlights of your presentation. Thank you.
Thank you very much. Hello, everyone. I'm Ignace Cavanaugh. I'm the head of training at the African Center of Excellence in Data Science, University of Rwanda. The African Center of Excellence in Data Science is one of the 24 Eastern African funded World Bank projects for the capacity building of Africans, and most especially in data science. Data science actually is coming to supplement existing domains, including mathematics, statistics, IT, and it is a combination of a number of tools, algorithms, and machine learning principles to unveil hidden patterns of events, phenomena, and in this specific area, when it comes to health, it is highly needed because it can provide real-time information and to disclosure diseases, disease patterns, and their treatment, on-time treatment. The African Center of Excellence may come on the multidisciplinarity of its nature, as mentioned by my former panelist, is that it can be applied in a number of areas. And for us at the African Center of Excellence in Data Science, we are training Africans who can apply this in biostatistics and bioinformatics, which is much more related to health, to demography, to econometrics, and to actuarial analysis, kind of. And since the African Center of Excellence started, we noticed that there is a huge need for this training, because every year that we launch a call for application, we have a big number of applicants. This year, for instance, we have registered more than 600 applicants from 14 African countries. Even though the African Center of Excellence in Data Science was actually created to serve Eastern African countries, we can see applicants coming from Northern African, Western African, Eastern African, Southern African, even Central African countries who are eager to learn or to improve their knowledge in this field of study. And we have now a master's and a PhD program in this field. So we've been noticing this thirst of learning, and this will be highly contributing to the knowledge in Africa. We have so far registered a number of challenges, and we notice the need is here and there. So the challenges, some of the challenges includes the sufficiency of infrastructure, but also educators or trainers or professors. And then we try to outsource from here and there through our network and partners in Africa and abroad, in America and elsewhere. We have, being a blend of knowledge, we have to diversify trainers from epidemiologists, biostatisticians, IT experts who are applying this knowledge in this specific field. But also we have other aspects which are the enhancement of data sharing policies in our respective countries by the adoption of data revolution policies. And this is a brief of my presentation. Thank you very much.
Yeah, thank you, Ignace. I really, really appreciate you sharing your experience, and just knowing the amount of interest you're getting tells us that there's a lot of need for data science capacity building. Those are excellent highlights. Let's now get into some depth about what around the topics that have been highlighted by our panelists. And we've also been receiving quite a number of questions from participants. And so we'd like to go through them. For the panelists, please spend 1 or 2 minutes, 2 minutes maximum, responding to a question so that we can get to a number of them. So without much further ado, I would like to ask a question. Mahadia, I'm going to start with you. There's a statement that capacity building approaches in data science should respond to identified gaps. Mahadia, in a minute or two, as I've stated, can you tell us what approaches you would use or recommend for identifying capacity gaps or the market needs in data science? And this is both organizationally or at a country level within an African setting. Mahadia, over to you.
Thank you very much. So with our experience of delivering capacity building programs where we have delivered to over 300 individuals, so what we feel that works best in identifying the gaps is first understanding what are the core challenges and how do you want to solve them through data science. So that should always be the first point. So we do that either using roundtable or we do that using training need assessment, which we either do offline or online through surveys, periodically through our network of alumni or through our partners. So that's how we normally do in order to identify the data science skill gap.
Thank you, Mahadia. For the other panelists, does anybody have anything to chip around how you go or you'd advise someone to identify the capacity gaps?
Yeah, I want to echo what Mahadia said. I think surveys are a great way to sort of identify different gaps. And I keep insisting on this, but getting people to collaborate together is also a very good way to identify gaps and sort of remediate to that from these collaborations. But yeah, totally agree. Surveys and evaluation is a great way to identify gaps.
Thank you so much, Amel. I will jump to the next question just because, Amel, you're kind of getting going here. But before I talk about the next question, I just want to mention to the participants that the chat is open and you can put in additional questions there, and we'll try to get through as many questions as possible. So, Amel, there's a question that has come up, and it says, in your presentation, Amel, you mentioned various training modalities and teaching approaches, including hackathons. Do hackathons contribute to the use of research findings in policy and decision making? So do hackathons contribute to the use of research findings in policy and decision making, or are they only focused on training through real life problems?
This is a very good question. And so as part of H3 Bionet, we organized different types of hackathons that had different objectives. Some of them had as objective like building some bioinformatics workflows. And we made these workflows available after that to the whole scientific community and to use them and also to contribute by providing feedback. Other hackathons, like the Dream of Malaria one, were hackathons where we got people from different backgrounds, different institutions, collaborate together to prepare a data set for a crowdsourcing and a global public health challenge on malaria drug resistance. So it really depends on the way hackathons are set up, and it really depends on who you get involved in the hackathon. So if we really want to focus on impacting policies and change like procedures in different countries, different regions, it is important to get people involved, like different stakeholders involved in the process, so that it is a collaborative process that is going to lead to thinking about what policies you're going to suggest. And having people from diverse backgrounds and people involved in different processes involved is a key. So yeah, it really depends on the objectives and who you get involved in the hackathon, but it could.
Thank you so much, Amel. I just want to follow up on that question because I see that about 26% of the people here want, at least in the survey response, they want to learn about approaches to train health data scientists. And we mentioned hackathons. I'm sure there are other modalities that the rest of the team has explored in terms of the approaches. Maybe Jeremy, if you could just walk us through what approaches to training you've seen to be most helpful in a minute or two. And then also, Ignace, if you could also tell us what approaches you think are best for training health data scientists, or how would you advise participants here? And then Amel, you can have a final word on this topic. Okay, so Jeremy, 1 or 2 minutes.
Thank you. From our experience, the most important thing is to define clearly both the problem and the goal we seek to achieve. After we have established the problem and set our goals, we can better identify the people who are best able to contribute. So in general, what we used to do is with our board, have a discussion related to the public health problem we want to solve. What are our experience, our skills, our expertise, and how we can best tackle this health problem. And then we ask for lecturers from our partners, and that's how we work. We used to address the problem of training.
Excellent. So Ignace, I think that really helps. So between open learning platforms out there, hackathons, practicums, lectures, can you walk me through how you moderate kind of those different modalities when it comes to data science training?
Thank you very much. On one hand, I would say there might be formal lectures and enrollment candidates from here and there in specific disciplines. And this is a very formal way. But on the other hand, hackathon can be very useful in a way that, if I may actually mix it with the problem, the existing problem, in a way that we are actually encouraging, it's like inciting participants in hackathon to come up with not only a problem, but also a solution. And that those respective or many solutions that participants in the hackathon are presenting will be very useful to either inform policymakers, but also health practitioners in a way, and in a way that it discloses a finding and the solution, an algo or a machine learning algorithm that is solving a problem. The other thing is engaging community members to themselves identify a problem and come up with a simple, very simple way of solving it using simple mechanisms. Like we are introducing currently in our respective countries coding schools for not only professionals who are highly qualified, but also even young students and younger generations who are trying through the coding to have a problem and then come up with a solution to that problem in our respective countries. This is a way of engaging community members in their setting to come up with a solution to a problem, say malaria or any other health issues in the respective. The other thing is training. We might organize, or here at the African Center of Excellence in Data Science, we organize blended courses which are like capacity building courses, and we advertise, and industries, institutions in the region and in Rwanda apply, and they come, we train them, they go back, and we make sure we organize these courses on a seasonal basis. They are repeated. They share their experience and so on. So these are some of the ways we apply this in here in Rwanda. Thank you very much.
Yes, thank you, Ignace. I think I'll have Mel have the last word on the different modalities, given that it featured prominently in her presentation. So, Mel?
Yeah, thank you, Martin. Yeah, there are definitely different modalities and different learning styles, and to each we have like our own way to learn better. This is also a very challenging field where things change very quickly. There are packages and tools that are made available to the community every day, basically. And so continuous training is a key, but also diversifying the ways we deliver trainings is also important. Mixing practical and theoretical parts is also important. I remember running one of the courses as part of the Pasteur Institute's network in collaboration with Bionet, where people all came together for a whole week of theoretical courses on NGS data analysis. And then they spent the second week of the training just basically brought their own data sets and spent the whole week working on their own data sets. Some ended up working together. Like they didn't end up working on their own data set, but they ended up collaborating with another attendee of the course on another data set. And they all mentioned it was a great learning experience to them. Finally, I want to sort of echo what Ignace said and the fact of the importance of communicating to policymakers. So if we, let's say, run a hackathon with some specific objectives and we're willing to have an impact on policies, a key is communicating the results, like communicating the science that is being done in a good way to the community, like to have the community involved and also understand, because we all work on the public health field, right? And communicating it the right way to policymakers is the way to impact policies and impact decisions and procedures that are going to be put in place.
Thank you, Mel. Thanks everyone for the summary of this very important question. Just want to pick up on this. We have a very good question from the audience. Mahadia, I'd like you to take first stab at this one. Capacity for research seems different from workforce training. Okay, what additional steps do you take to create the whole environment for research? Okay, so basically, when you're talking about data science training and research capacity building, so from funding, getting the right resources, constituting the teams, getting the relevant data to do research, what ideas would you give the team in terms of how to build the research capacity or to train people to conduct research around data science, in particular biomedical data science? Mahadia, and then maybe Ignace. And again, 1 or 2 minutes in response.
Okay, thank you. So I'll share my experience from the MSc Data Science program that we support the Human University of Dar es Salaam. So first, data science skills, the way they are, is like you're building a person to be curious, and data science skills themselves embed the analytics part. So starting building how to research on the problem. So with our MSc Data Science program, what we do is first attach them to the real world organization so that they could work on real world challenges. So training them in class on the theory, but also working with the organization in terms of identifying the challenge. So starting on researching on what is the core challenge that organization is trying to solve, or what is that data science gap that is in there. So working on the real world problems is key so that they are able to tie in whatever they are learning in class with what is actually available in the real world. So that one is like building them the hands-on skills. And for the MSc in Data Science program, for instance, in trying to emphasize on research skills, so under the capstone project, we ensure them at the end, so they publish the results so that they are building their research. So they are writing the paper at the end, they're publishing their results from the capstone related projects. So that is how we actually work with the MSc student to ensure that they don't only get the practical skills, but also they actually are able to get the research skill and publish their results.
Thank you so much, Mahadia. I'm actually going to switch a bit and ask Jeremy to also respond to the research training aspect of things, just because you do quite a bit of that. And then Ignace, I'll come back to you with another related question in a moment. So Jeremy, in 1 or 2 minutes, on basically, how do you constitute and train people for research in data science? From constituting the funding, the other resources needed, the teams, the data to conduct data science research. And you can use your photonics group for reference, for example. I think you're still muted.
Yeah, good. Our experience in this area is, we are firstly, as I said, we are experimental physicists. So generally the goal is to build an instrument to address some public health problems. The idea is mainly to make a choice to reduce the cost of the instrument. So instead of tackling the problem from the analytic point of view, we will try to get the same results, including data science methods in our perspective, in our approach. So generally what we do is to try to identify the best technical approach in data science which fits better with our instrument we want to build. So the students are trained, in fact, around an instrument, around a specific problem or around a specific technical problem to address using the data science. That's how it works in our experience.
Thank you, Jeremy. And sorry, I kind of caught you in the middle there. It's a bit of a complex and basically question that has multiple angles to it. So hopefully people can also respond in the chat to that question. I wanted to switch gears, and this question is first to Ignace to help tell us, especially for degree programs, and then maybe then to Mel on kind of the short-term training programs, and it's the issue of quality. Okay, so the issue of quality of training programs often arises, especially in a new and developing scientific area. So Ignace, do you have any suggestions on how to assure quality of the capacity building program, for example, degree programs, especially in reference to national, regional, and international standards? So this goes to the issue of competency, accreditation, and standardization of the quality. So please, 2 minutes maximum in your response to this question, please. Ignace, over to you.
Thank you very much, Jeremy. This is actually a very highly needed aspect of the training in data scientists in Africa, because whenever the need is there, people tend to come in numbers, and sometimes we can have programs developed here and there without meeting even minimum standard. And at the end of the day, we might expect to have data scientists who have degrees, but sometimes who don't have capabilities to solve issues that need to be solved by data scientists. So the way actually of ensuring the quality of the training, even on a general perspective, is relating to the accreditation. The programs, the accreditation of programs in our respective countries. We have higher education councils and ministries of education, which are there to make sure programs that are being provided are accredited, and there are guidelines that are being followed up. And on one hand, there are small training centers that are being organized here and there. But apart from the country level accreditation, we need to have accreditation institutions that are in Africa or in regions of Africa, but also international ones. For us to start our program, we started getting accreditation from the Ministry of Education, the Higher Education Council of Rwanda. It was really tough, and at the end, we were obliged to find accreditation from an international institution. And currently, we are in a partnership with them. We have been accredited by the Data Science Council of America, that's through which not only our program is accredited, but also on the other hand, the short courses that we are providing are straightforward coming from DASCA. So we have short courses which we are providing from DASCA. So in brief, we need to have an accreditation system, and a tough one, not only which starts from the country level And our countries need to have tools for that and understanding and knowledge. We might have encountered some challenges in accreditation assessors in our respective countries. Some of them are coming from IT, others are coming from there. But apart from our countries, we need to have put in place accreditation bodies at African continent level, but at regional level, and then look for partners at an international level. Thank you very much.
Thank you, Ignace. Really appreciate, and I like the diversity both for short and short courses and degree programs. Mel, just give us a brief on the quality assurance aspects of your work and how you'd advise participants on mechanisms to quality assure their work. Thanks so much.
Yeah, sure. So to Ignace's point about accreditation, HRA Bionet put in place what we call a node accreditation process, and it's a process via which different nodes and partners in the continent get accreditation in a specific topic. There were topics around RNA-seq analysis, DNA-seq analysis, etc. When it comes to assessing quality of short courses, I think it is really important to focus on harmonized programs and sort of have an identified set of core competencies and additional competencies adapted to the need and to the expected outcomes of the course. It is also sort of very important to find the right balance between what you as course organizers identify as outcomes, but also find the right balance when it comes to different attendees' backgrounds. Because training in bioinformatics or data science, it is, again, a very rapidly evolving field. And when you gather people coming from different institutions and different countries, when we all don't use harmonized programs, there's a little bit of time we need to spend there to sort of make sure everyone is at the same level or have a similar level of understanding of certain concepts to be able to follow the course. So yeah, identifying clear outcomes and sort of try to carry these throughout the course or the training program is important.
Thank you so much, Mel. We have so many questions. I want to actually talk about the gender gap question next. We have about 7 minutes, so we might be able to answer 1 or 2 questions before we go to the breakouts. So I will start with this question. Mahadia will take it first, and maybe Mel, you can chip in. So given the huge gender gap in data science skills, okay, so more than 70, I think Mahadia is saying that only 1/3 of her students were female. What specific approaches are you taking to ensure that women along different stages of the academic journey, so both secondary, graduate, postgraduate, are encouraged into data sciences? And what are some successful examples? Mahadia, over to you.
Thank you very much. So gender gap in data science space is really an issue. So we have tried different approaches targeting different levels. For instance, we have a philosophy where we are saying we are trying to catch them early, where we work with the organization at the, we work with the secondary schools. And I've seen a question on how you involve private sector. So actually under that program, we are working with the Vodacom Foundation, which is a private sector. So what we are doing is trying to train coding skills, understanding that coding is a core skills for future data scientists. So trying to train them, and then we are making a very short-term programs, like for 4 days. These young ladies could understand that under 4 days they could be able to, let's say, develop a website. or under 4 days, they could be able to do a very simple analysis. So with that, you bring for them like a curiosity, but also an interest. And we have examples where students who have gone through Code Like a Girl program are now at the University of Dar es Salaam pursuing masters in, pursuing computer science, pursuing computer science studies. So trying to catch them early. But then with these digital skills, there is normally a community that is left behind, girls and community schools where they don't have infrastructures. So for us, we have a Smart Girls program where we are targeting girls in these community schools. So we are training, we are going there at the schools with our facilities, but leveraging their holiday session to come at the data lab to use the facility, the computer and the like. It's very important when we are talking about this digital divide to also think about the community, the girls at the community schools where there is no power, electricity and that, but also focusing at the girls at the, focusing at the girls at the college. We have a program, let's say called, a program called Data for Her, where we have yearly commemorating Women in Data Science Conference. In this program, we are collaborating with the Stanford University and Institute of Computational and Mathematical Engineering, where this one, we are trying to train them not only computer science skills, but also communication skills, because communication is a key skill for a good computer scientist, because your results, you need to communicate them. And we want to create also a pipeline of these female data scientists. And we want to see them that they can climb the ladder. So such soft skills are also important so that we are retaining the few female scientists that are in the field. Yeah, thank you.
Thank you, Mahadia. Mel, just briefly, maybe 2 minutes.
Yeah, I loved all what you said, Mahadia. And I think it is really a key to have young girls involved since the very beginning, because if we don't train young girls and sort of attract them to the science and computing field since the beginning, then we won't find women represented in our universities and different institutions. I myself also spent a lot of time running a program for young girls in Tunisia where we teach them coding, but also teach them entrepreneurship, and they get to build mobile applications to solve community issues. But then once we have these women integrated in the university, the academic system, or different research institutions, I think people who are in a position of leadership really have to be conscious about this gender representation constantly, and keep like putting in place processes by which they make sure women are part of the discussion. They bring women to the table all the time, like, and also make sure that women are not only, you know, data scientists or coding, but also involved in decision making. And a shout out to Accreditation here, because they've done a very good job in terms of women representation and allowing women to lead different projects, and also to be, you know, represented at different committees of the consortium.
Yeah, thank you so much, Amel. I'm actually excited that, you know, we have the two of you as leaders and experts and mentors to a lot of the upcoming female data scientists out there. So hopefully a lot of the programs will take gender equity into considerations, and also it can become part of kind of policy making, and, you know, opportunities for scholarship and things like that can be given to the female candidates. So we are right against our hour for the first part of the session. I really want to thank everyone who's posted questions. We're getting a lot of them in, and hopefully we'll have more opportunities to respond to this thereafter. And I really want to also thank our panelists for their very insightful responses. It's now time for the breakout session, and I will hand over to Puleng to inform us how the breakout session will work. And we'll see you all back after the breakout. So Puleng, over to you.
Thank you so much, Dr. Wari. What a wonderful discussion. What an insightful time. What an informative discussion. Thank you for to the questions. Really appreciate it. It's wonderful to listen to you and to listen to us. And the discussion was very thought-provoking. And we will again later on. But for now, it's everyone's time to have discussions, to have conversations, to share. And we would like to give everyone else into breakaway rooms, small sessions, groupings that are entirely random, so you can get to mingle who are also sharing this as you. Now, when you get into a breakaway session, we would like to invite you to introduce yourself very briefly. And then once you have introduced yourself, where you come from, maybe your interest and what brings you here. The second thing is discuss the following on the screen. What do you see as the biggest challenges in the health data science leaders in Africa? To leverage existing infrastructure systems and networks to overcome these challenges. So what do you see as the biggest challenges in health data science leaders in Africa? And how can we leverage existing infrastructure to these challenges? So you'll have about 30 minutes. You'll have groups of 4 or 5 get together, and we'll send you some notices to make sure that you keep up with time and you're aware of the time, and make sure that everybody gets a chance, firstly, to introduce themselves, to share a little bit about where they come from, and then have a thorough discussion about the topics on the screen. These prompts are also pasted on the chat. You'll see them on the chat. You can copy and paste them as we send you into the breakaway rooms. Maggie,
yeah,
do you have a couple of... Yes.
I do. I just have a few tips before going into the breakout room. It really helps once you're in there if you turn your video on. It's just easier to talk to someone if you can see them. I know some of you have some bandwidth issues, and we understand that, but please try to turn your camera on while you're in the breakout rooms. Joe is going to move you to the breakouts, and sometimes it takes a little bit more time. So if you get there and you find yourself alone for a while, please don't panic. Wait for a while, because somebody will join you, and Joe can see you from his dashboard, and he'll notice that you're alone, and he'll send somebody in. So please don't panic. Wait a while. However, if it takes a couple of minutes and they go by and geez, nobody is coming, I'm here all by myself, by all means, go to the blue button at the bottom of the screen and leave the breakout, and you'll come back into the plenary session, and we'll make sure that you get put into another room so that you can have a discussion with people. And of course, if you get bumped off Zoom altogether, which can happen from time to time, you can just come right back to this plenary room through the page that you used to enter here, or anytime there's a panic, you can always go down the Chi-Storm menu to the Need Help page, and we'll help you from there. So, I think that's good enough. You know the questions. Have a nice conversation.
Fantastic. Thank you, Maggie. And remember, guys, the 3 prompts. Introduce yourselves very quickly. Check the chat for the 2 questions that we would like you to discuss. You have 30 minutes, then you'll come back. And please be patient with the Zoom rooms. If you do get cut off, just reconnect again. Or if you find yourself alone, just come back into the main plenary. We'll send you back with the groups. So please be patient. Over to you, Joe.
So I have imagined that you have met some interesting people and had some interesting conversations, that's what we're in the business of here, is helping you to meet interesting people and have interesting conversations. This group is large. We're like 100 people or more. So it's too difficult to hear back from every single group about what you discussed, but we really want to know. We're curious, and we believe that the other groups can benefit from hearing about what your group discussed. So we invite you now, if you would, to use the chat, and you can just type in some insights that came to you about the challenges that are part of this whole process of training and capacity building for data science and health in Africa, and some of the potential overcomes. We'd love to hear your insights, or see them, I guess I should say, if you could type them into the chat, and we'll collect them. And I will tell you this again at the end of the session, but just to let you know, there is a way to save the chat. If you hit the 3 little dots in the bottom of the chat column at the very end of the session, if you hit those dots and save the chat, you'll be able to keep all of the questions that were asked, as well as any of the insights and comments that people share now. So, but for now, please give us your insights. Let us know what came out of your discussions. And Dr. Were, I send it back to you and the panelists to share your closing thoughts, well, to answer a few more questions and share your thoughts.
Yeah. Thank you, Maggie, and welcome back, everyone. It's often hard to come back to the plenary after you're having such an exciting breakout session. So while you put your comments in the chat, we'll take a couple of minutes to just ask our panelists to also reflect on the breakout session topics. I will start with Ignace and then Mahadia, okay? What do you see as the key challenges in training health data science leaders in Africa? So if you could each take a maximum of 2 minutes just responding to that. Ignace, over to you.
Some of the challenges actually include the policy level. I will talk at policy level and private sector level and so on, in terms of adoption of data science education in Africa with all its requirements. For data sets to be properly educated or trained, we need access to data. And access to data needs not only partnership with the public policymakers, but also with the private sector who own data. On public policymakers, on one hand, we need our policymakers in Africa to adopt a data revolution policy, which we need to advocate for right now. We need our respective African countries to understand, apart from understanding the usefulness of data science in the revolution of development in our continent, to also understand the requirements in accessibility and data sharing. And the governments in our respective countries need to create a platform through which the public institutions in healthcare, for instance, you know, they are the most institutions that protect their data because of privacy and so on. They need to come up with the policies which are favoring the sharing of the data with specific guidelines, put in place guidelines. But also, on the other hand, apart from the data revolution policies which need to be adopted in our countries, on the other hand, we need the private sector to be, I would say, let me use this term, educated about the need to share data. You need to share your data for what? On one hand, once you share your data, users of this data can come back and inform you about other features of your business, and which will contribute to the success of your business. But also, on the other hand, using your data might be useful in informing policymakers on one aspect like healthcare. Today we are talking about COVID, for instance. For us to properly predict COVID prevalence in our respective countries, we need data on mobility, for instance. Data on mobility needs collaboration with telecommunication companies, most of them being private, who own data on this. So a number of aspects. These are challenges we are having, and we need this to be put on table and then to be facilitated for our students to access these data and run them and then come up with a solution. Other,
Ignace,
yes.
could you take half a minute just to summarize the points, just in the interest of time?
Yes, other aspects include funding. Government should allocate a portion of funding of the budget to the development of data science. It's a field which needs infrastructure. It needs infrastructure either to be taught online or face-to-face. It needs specific infrastructures. So the support from the government is here, direly needed. Thank you very much.
Thank you so much, Ignace. Highly appreciated. So data sharing and funding as some of the key challenges. Mahadia, any other key challenges in training health data scientists leaders in Africa? Over to you.
The other key challenge is the infrastructure. So when we talk about in Africa, we are talking about internet, the connectivity, the issue of connectivity has been a challenge. So most of the time when we talk about these data science skills, we normally talk in the cities, but we really don't include remote areas in that aspect. But also when we talk about infrastructure, also even the computing capacities. You want to train a student in big data analytics, you end up training them using visual machine, which you can't fully explore you cannot leverage the benefit of big data analytics because of that limited computing power. And the last thing that I wanted to say is also gender has been a key issue, a key challenge in data science, how to motivate more women into data science space. Yeah, thank you.
Yeah. Thank you so much, Mahadia. So I'm hearing issues of data access, issues of funding, issues of infrastructure, issues of gender equity, among others. And I'm sure there are quite a number of ideas and inputs on the other challenges in the chat shared by the participants. So Jeremy and Amel, recognizing these challenges, how can we leverage the existing infrastructure, systems, and networks to overcome the identified challenges? What approaches can be used to overcome the challenges that have been identified in training data science leaders in Africa? I'll start with you, Jeremy, 2 minutes, and then I'll hand it over to Amel. So over to you, Jeremy.
Okay. Thank you, Martin. I agree with the challenges which have been identified. To share I've seen experience, some of our students were not able to access to a broadband internet connection, for example. There are a number of infrastructure possibilities online, but in order to take advantage of these opportunities, they need to have the possibility to get connected. I remember I had a courses online 1 week ago, and some of the students were not able to participate in the course because they didn't have the internet connection for that. What we did is we looked for sponsors to pay kind of not really a scholarship, but a support, a financial support for them to pay for internet connection. The other thing which are very important is that sometimes they need some introductory session to get hands with these methods. So what we did is to get in touch with the people providing these links, to give them the requirement to be able to take advantage of these possibilities online. Yeah, I think that's some inputs I can bring regarding this question.
Yeah. No, thank you very much. There are actually also a lot of good comments in terms of some of the additional challenges in the chat. So those are highly appreciated. So Jeremy, we appreciate your response. I'm going to hand it over to Mel on how to overcome the challenges.
Yeah, I think a key is to leverage existing resources, like in terms of computing resources, but also all the curriculum that have been already put in place. And so instead of reinventing the wheel and starting again from scratch, like using what has been built and reaching out to people who have been developing different programs or setting up computing resources in the continent or in different regions in the continent is a key. And so it's a way to sort of keep the ball rolling. And making what you also develop and bring to the system available and be open to collaborate yourself will keep people further developing and improving systems that are in place. I think that's it from my side. Try to keep it short.
No, thanks, Amel. And you know, I'm gonna go back to you because I'm seeing a lot of comments here in terms of people saying that there are challenges around partnerships or people working in silos or people not being aware. Can you speak to the role of other multi-sectoral or multidisciplinary partnerships when it comes to data science training? So for instance, what's the role of the private sector and also what's the role of healthcare professionals? After that, Ignace will also hopefully make a comment. So Amel, back to you again.
Yeah, so in these sort of multidisciplinary environments, again, collaboration is a key, and bringing different perspectives to the table is a key to solve these challenges. I can speak of a very good example that as part of my current role, like in the Knowledge Integration Grand Challenges program in Brazil, the local team there is doing a very good job in terms of connecting data scientists, epidemiologists, physicians, and different projects with public stakeholders, like people from the Ministry of Health and different public health institutions in the country. So these people are involved in the development process. They also did a very good job in terms of connecting these projects with designers and data scientists who help them better design their products that could be used by different stakeholders they're targeting, or also being used by different patients. And because we're also talking about data science and using a lot of data, I think collaborating with people who have strong knowledge in all the ethical aspects is a key to make sure that you know what you're doing with the data. And it is also part of the trainings. It is important to raise awareness since the very beginning. Hope that answers a little bit the question.
No, thank you. I think it does. You've touched on several aspects of partnerships that might not be as obvious sometimes. Ignace, I know in your program in Rwanda, you also have a lot of partnerships that you've established over the years. Could you just give us a sense of both partnerships from kind of collaborators involved in providing data in the policy aspect of things, in the research aspect, but also partnerships in terms of the teaching expertise needed?
Yeah, thank you very much. Data science actually being a field of study which can acquire, first of all, skills in data, big data analytics, but also on the other hand, to be applied in a number of fields. We have adopted to a certain extent, not that bigger extent, but a multidisciplinary aspect of it by considering the data science in healthcare, in health analytics and bioepidemiology, by including biostatistics, but also in this way, we are partnering with, for instance, the Rwanda Biomedical Center in analyzing a bulk of data, a bunch of data from on a number of aspects, malaria, but also other emerging diseases, including currently corona. And our students can access these data and then apply the machine learning techniques to predict and so on. Apart from the healthcare sector, we have the banking and insurance sector. We have the actuarial scientists. We are training actuarial scientists. And these insurance and banking sector need risk analysts who can predict and, for instance, come up with an advice and information on, for instance, loan defaulting aspects of a client of a certain characteristics. And our students have developed such algorithm for the banks here, and which ended up even recruiting them. But also on the agriculture sector, the Ministry of Agriculture and the meteorology, which is giving us climate change or data. And from these climate change data, we can predict the likelihood on the harvest, the yield outcome on a certain. We also partner with telecommunication companies to not only predict mobility and inform, for instance, the traffic jams in the country, but also predict a number of other aspects. So the multidisciplinarity of data science per se is there, and it needs to be used by tapping into or using this opportunity to serve a number of institutions, both public and private, on our African continent. Thank you very much.
Thank you so much, Ignace. And it's also excellent just to see that beyond health data science, you're doing quite a lot in the field in Rwanda. And hopefully some of the lessons can be generalized also to the health and biomedical aspects of data sciences. So thank you. We see that we have a couple more questions that came in during the breakout session, and we want to get back to them. We have about 8 to 10 more minutes left before the end of this panel. So I'll just switch gears a little bit, and we'll address the next question to Mahadia. And this is the issue of outcome measures. So how can we measure outcomes and impacts of data science capacity building projects? So instead of just talking about the number of people trained, how can we measure outcomes and impacts of the data science capacity building projects? Over to you, Mahadia.
Thank you. So, so that is really a challenge, and we have also struggled at the beginning on seeing how we can measure the impact, understanding like our program, we are training the data scientists in collaboration with different partners like Virginia University, George Mason University. So at the end, we decided that they should be working on real world problems with organizations. So we attach these data science scholars to organizations, and then at the end, they present solutions. So try to link their theory to the real world challenge. And with that, we have seen a good example, like the last year batch, we had a data curation tool where a health NGO could upload their data and could show where there are loopholes in the data. And then we had another solution in trying to identify who are likelihood patients to drop for antiviral care. So it's important to link these scholars with the real world challenges, with the industry or organization, so that at the end they develop solutions. There you can say that you really trained a data scientist and they have come up with a product.
Thank you so much, Mahadia. I don't know if any of the other panelists wanted to share kind of some of the biggest impact measures or outcomes they've had from their capacity building initiatives. Jeremy, Amel, Ignace, just what do you feel was the most impactful aspect of your capacity building initiative? Or do you have a good story to tell from capacity building someone?
I have one, Martin.
Yes, go ahead, Jeremy.
Thank you. in our cases, for example, as I said in the beginning, we are building instruments, and we were able to have the same type of instrument with the same effectiveness by bringing data science in the processing data. And for an instrument initially costing about 30,000 US dollar, we were able to propose another instrument with the same output with only 700 US dollar. So I think we may see it as a good matrix in terms of measuring how data science can tackle some developing problem in Africa.
Okay. Yeah. Thank you, Jeremy, for that example. I'm sure there are tons of examples. I just realized in the interest of time that there was one other question that we really wanted to get covered today. So if you notice at the beginning of the poll, about 17% of the people were interested in learning about opportunities in data science for their own self-improvement. So the question I will ask to Ignace for 2 minutes, and then Mahadia can chip in maybe for a minute. If anyone in the audience is interested in improving their own data science competencies right now, okay, where should they start? Okay, Ignace?
Yeah. Thank you very much. Data science is a discipline which is multidisciplinary by nature, and it requires basic knowledge of both IT and mathematics to a certain extent. When we recruit, we hire, we enroll students. Some of them are coming from IT. When they reach the center, they have IT skills, but they don't have strong mathematical or statistical background. So we have to leverage and build on this, and then build their capacity in this. And then before they can start computing and running machine learning algorithm. But this is not as such very complicated. I saw on some of the question attendees were asking whether is it necessarily of a paramount importance that you have mathematics as a background. We have short courses which are offered at our respective institutions, and these courses can train you from being a basic data analyst, having that level, and then improving with time. For instance, I may talk about the DASCA programs we have. We move from principal data scientist, senior data scientist, associate big data analyst, and then senior big data analyst. But also, apart from there, we have other programs. Google is offering some programs online. Microsoft is offering some programs online. So a person can enroll in any of these programs and start slowly. And then if the interest is there, he will grow into a very good data scientist from where he is departing from. Thank you.
Thank you so much, Ignace. And it's just good to know all those resources exist. Mahadia?
Yes, so I'll talk brief on just two aspects. First, at the individual and institutional level. So at the individual level, just building up on what Ignace mentioned, it's also important while learning these from these different resources. So you have a certain project that you are working on so that you can directly apply your data science skills to such project. But at the institutional level, which is also important to improve the skills, partnership are key with the organizations that have already advanced. For instance, at dLab, we have partnered with George Mason University, University of Virginia, Digital Health Africa. So partnering with these different, this institution, leveraging from the strengths of one another is important in also building institutional capacity in data science.
Yeah, thank you so much, Mahadia. Really appreciate it. Well, I notice we are up against our time once again. All good things always have to come to an end, it seems. We only have about 2 minutes, so I would like to thank our panelists for sharing their experience and insights. We also want to obviously appreciate you for staying with us for the 2 hours and for actively participating and engaging in the chats and in the breakout session. We hope the presentations, the panel discussion, and the breakout have provided you with some new insights around the various issues in data science capacity building in Africa, and that it was time well spent. Obviously, our appreciation goes to the No Innovation team and the NIH, with special thanks to Laura Povlich and her team for making this panel possible. So this will end the panel discussions session. And I will now like to hand it over to Puleng for final words around upcoming events. So thank you so much, everyone, and over to you, Puleng.
Thank you. Our deep and sincere appreciation goes to you, Dr. Were, for moderating so wonderfully, and all the panelists for sharing your rich knowledge and insights. We really thank you. Thank you for a rich discussion, for an informative session, for an engaging session, for the many opportunities that you present to the audience today. Thank you so much. You have really shown the importance and the impact of strong partnerships. Now, as we draw close to the end of our session today, we would like to remind you a few more things. So, firstly, if you are on social media, you are tweeting or writing LinkedIn articles or on Instagram sharing, remember our 3 hashtags, hashtag DSI Africa, hashtag NIH Africa Data, and hashtag No Innovation. Please use those hashtags as you share. And we have 2 more days to go, and tomorrow's panel on Tuesday is about ethical, legal, and social implications of data science. So just like today, we have collected a very interesting group of panelists, experts in the subject matter of ethical, legal, and social implications. And so tomorrow again at 9 o'clock EST and 4 p.m. EAT, we will have interactive sessions with those panelists. And we encourage you to preview the ethical, legal, and social impact panelist videos in advance. So if you can't, then you can just go to the screening of the videos, which is always scheduled just an hour before the interactive session. So it will be tomorrow at 7:30. So that's what we should look forward to tomorrow. Otherwise, on Wednesday, we'll have yet another session on data ecosystems and gateways. So we look forward to another interesting interactive session on Wednesday. And then on Thursday and Friday, we have what we call the FOA office hours, and we'll tell you more about that. Maggie, I would like to hand over to you.
Thursday and Friday, the office hours. There'll be office hours for research hubs first at first thing in the morning. You can see the times there, and research training program happens after. So from 8 to 9 a.m. Eastern time, and then 9 to 10 a.m. Eastern time, or 3 to 4 p.m. Eastern Africa time, 4 to 5 p.m. Eastern Africa time. Friday, we have ethical, legal, and social implications. These are the office hours from 8 to 9 Eastern time, 3 to 4 Eastern Africa time, and Open Data Science Platform Coordinating Center from 9 to 10 a.m. Eastern Daylight Time in the US, and 4 to 5 p.m. Eastern Africa time. So that's that. I think that's what I wanted to share with you. Yes. So I just want to remind you the tip that I gave you before, which is that if you go look at the bottom of your chat, there are 3 little dots. Click on that and you'll be able to save the chat, and you can have all of the questions that were asked, as well as all of the rich insights that came out of the discussion groups. So you can keep that, it'll save it right to your computer and you'll have it. And if your breakout discussion was somehow interrupted today, it always feels like we interrupt people's conversations, we encourage you to go to the network lounge. Okay? Or if you're just interested in networking with other people, go to the network lounge. You can scroll down the left-hand page of KaiStorm, find the network lounge. There's an opportunity to push a button and go into the space where you can roam around and pull your avatar next to people and have conversations. We encourage you to go in there and chat with people randomly. Also, a great thing to do is to make an appointment to meet somebody. You can send them a chat and say, I'll meet you at 5 o'clock at table 5. All of the tables in the network lounge are numbered. And so, or you can just bump into someone randomly there. So we invite you to go. So I think the last thing would be, on your way out, there is an exit poll. It's in the chat. And we would really, really appreciate it if you would take just 1 minute. It's really quick, but we love to get feedback from you about how you felt the session went, what you got out of it. So please quickly, if you could do the exit poll, we'll be very happy. Other than that, thank you everyone for your presence today, your participation, and we'll see you tomorrow. The interactive panel session, 9 o'clock a.m. Eastern Time, 4 o'clock p.m. Eastern Africa Time.
Thank you.
Bye-bye.
Goodbye.